Hi, it's Adrian from Dental Artistry. One of the most challenging cases for us to do as implant dentists is an immediate replacement of a front tooth. And of course, it's a bit different when we're doing a back tooth because that's more a functional reason for replacing. When we're doing a front tooth, it's not only functional, but it's also cosmetics. And in those patients that have very demanding cosmetics, it has to be done very carefully in order to provide the best survival for longevity. And longevity doesn't just mean that the crown is going to be there for the rest of the patient's life, but it's also the soft tissue architecture around that area over the next 5, 10, 15 years. When we're doing these cases, one of the most important things is to remove the tooth very gently. You can see in this case what we've done is we used periotomes and gently loosen the tooth so that we can remove it without causing any trauma to the soft tissue or the bone. Once the tooth is out, we actually clean the socket very well, and we're placing the implant slightly palatal. We're using a very narrow platform here. This is actually a parallel CC implant with the new surface from Noble Biocare. We're placing this slightly palatal, and because this implant is smaller than the size of the root, we're of course going to have a gap or a space, and in this gap we're going to place some bios material. This is of course artificial bone, which we use to decrease the risk of bone collapse on the front of the implant. From here, one of the things, whether we've got thick or thin biotype, is we want to really create great soft tissue. So here we're going to grab a connective tissue graft on the palate and place it on the buccal aspect in order to reinforce the gum tissue on the front of the implant. And hopefully what we're doing is actually creating more gum tissue here than is needed. From here, once we've done both of these procedures, we have to maintain the area with a well-formed temporary crown. And there's two kind of theories around here. If you've got an on-site technician, it is worthwhile getting an immediate zirconia abutment actually made, which then we would then put a temporary crown over the top. The theory behind this, of course, is that you never remove the abutment, so therefore not break the soft tissue attachments around the abutment. If not, the other option we have, we've been doing this for many years, is do what we call an immediate temporary crown, where we're using a engaging temporary cylinder. We're using an opaque to actually mask the metal, and then over the top of this using rubber dam to actually stop the material going around the implant bone and the soft tissue. We're actually using rubber dam to actually stop or use as a barrier while we create the temporary crown. From here, the most important thing is the emergence profile, because this gives the support for the soft tissue. So you can see here what we're doing is using flowable composite in order to shape this emergence profile. Once this is actually created, we can actually screw the temporary crown straight to the implant, and from here the most important thing is to take the tooth out of occlusion, and that means that there's no biting pressure at all on the tooth. This is also eccentric and lateral, and very careful instructions are given to the patient so that no force is placed on this tooth for the next 3 to 6 months. We'll leave this for around about 3 to 6 months just to allow for not only the bone to go into the implant but also for total gum maturation. During surgery though, if the implant is placed at a very high torque, it's possible to actually scan for the final crown at time of placement. So you can see here we've actually put a scan body actually on the implant itself, and this is after the bone has been placed so that we can actually scan. We don't want a void down here because the scan of course won't be able to pick that up. Basically place the bone in and then we actually scan around this area, and you can see how we've actually picked up the scan body. So we've got all the information to actually make the final crown. We've also done a white balance color check or a shade check of this area, so we actually know the correct color of the tooth. From here, the temporary crown is actually screwed into place, and you can see the end result here. So the before here of the tooth, that's of course dark. The main reason for replacing this tooth is it was a root canal treated tooth with a failing root canal and a root fracture. Unfortunately, we couldn't do any other options. There was a very large access hole at the back which actually damaged most of the back of the tooth. There was no chance of placing a post-core crown or maybe putting a veneer over the front of the tooth. We really wanted a long-term treatment here. If you have any questions as a dentist, please leave them below. If you're a patient considering this treatment done, I'm sorry for the gory photos, but I think it's very important to actually do your research and get second opinions when it comes to this type of treatment. I look forward to one day seeing you in the practice.